Hi everybody, this is Dr. Sam and I'm on another walk. I'm actually on a trail called the Cobblestone Trail and I'm in the wilderness about 2 hours north of Santa Fe outside of a small town called El Rito. It's one of my favorite places. And as I was walking, I was thinking about kids and getting ready to go back to school. And it's kind of a daunting experience because man, having the summer off and going back to a more structured environment can be really challenging. And I really see that parents are struggling, with their kids. And I'm not even talking about the autistic to ADD kids, that spectrum, but just overall children that are having a bit of a struggle reading and learning in school. So I have a couple of recommendations that I am making to many parents. And number one, in terms of getting an eye screening, if you get an eye test where you're measuring the distance acuity, that is actually a really poor test to measure to see how kids are learning in school. What I recommend is actually giving a kid a book or something to look at up close and have them read to you and just watch their behaviors. If they want to bring the book closer to, their face, or they want to cover one eye, or their face is scowling, or you can just see that they're struggling, those observations can really be telltale signs that there's a vision problem. When I used to consult with the school nurses, instead of having them do the distance eye chart as a screening device, I actually would have them measure a child's visual acuity while they were looking at a near card, and that would trigger many more positive referrals that a child was having focusing problems with their eyes. I would say number two, nutrition and diet are so important. Make sure you include the fats, the good fats like omega-3, things like coconut oil and nuts and seeds. Our brain is about 60% fat, and we need fats. I would also include enzymes and probiotics to prepare the gut for better dietary absorption. Because when we have an intestinal imbalance or on a cellular level, we don't have the energy to learn and develop normally. And then number three, if your child is struggling with a problem, find a professional who can evaluate based on a developmental model. In other words, in whatever tests they offer, that they're comparing a child's chronological age to their performance age. When I was at the Gazelle Institute, one of the principles I learned was that we would evaluate kids based on a developmental model. We looked at what was their birth like, what was their gestation like, what was their bonding like, what was their motor development, creeping, crawling, what were the developmental milestones that they went through, because those are the foundational patterns that help our vision work properly, especially in school. So I'll leave you with this last piece of advice, and that is that bring your whole body into your visual experience. That means be aware of your body as you look with your eyes. What I find with many people, not just kids, but also adults, is we try to have a visual experience just based on our eyes and we forget about our body. And have the kids do things like hopping and skipping and jump rope. Limit the screen time. I wouldn't do any more than 20 to 30 minutes a day. Again, some schools are offering iPads as their main vehicle for learning. I don't necessarily agree with that. I think it's too hard on kids' eyes. Anyways, good luck, parents, for sending your kids back to school. And thanks for tuning in, and I'll see you down the trail.